All right, I'm going to go ahead and start to do just a little bit of introduction. I thank everybody for joining us today. Good afternoon, and I want to thank you for joining us for our first webinar today on Am I at Risk? Steps to reduce your risk. This is just one of a 5-part series on active steps you can take to identify risk factors related to impaired balance and how you can maybe prevent falls. So we hope you have the opportunity to join us for several or all of these lunchtime Link and Learns topics during this Fall Prevention Awareness Week. Our hosts here at HSC have been very gracious to provide this platform. And they did share with us that they will be sending you a weekly email with that link that you might have used today. And they'll open this room at about 10 minutes before the noon hour. So feel free to join us a little bit earlier if you'd like, because we don't want you to miss out on anything. So my name is Kathleen Camp, and I'll be your moderator for today's session. So we do ask at this time, as y'all have noticed, that your microphones are muted. This helps to prevent the background noise. I'll mute mine after I'm done introducing our speakers. And if you can keep them off during the presentation. But I'll encourage you again, if your internet signal and strength is strong enough and you're able to share your video, as presenters, we always love to look in the eyes of people. And so this is a virtual way that we can still see your faces. But if you find that your feed is a little challenging because of having your video playing, then just having your name on the screen is just fine. So do whatever is best for you. But if you decide to turn on your video feed, you'll notice that down in your lower left-hand corner, if you scroll your mouse down there, you'll see 2 icons, one that says mute and has a little microphone, and it should have an X across it at this time, but the other one is the stop video or a video icon, and so that's how you toggle those both on and off. If you are calling in on your phone, you'll press *6 both to mute and unmute your phone. So at the end, when we have some questions open up in some time, I'll announce and may ask you if you would like to ask any questions to callers that might be calling in that don't have access to the video portion. I'll give you the permission to unmute your phone and ask a question. So as you think of questions, if you are online and you would like to use the chat button, that is actually at the bottom of the screen as well. If you scroll down right in the middle, you'll see chat and a little symbol there for a little communication bubble. You can click on that at any time and it'll open a window where you can start to type in some questions or thoughts even during the presentation, and we will be watching that and use that to give some feedback and also to prompt some questions at the end of the presentation. And one last little button, if you'd like, on the far right is a reactions button. It's got a little smiley face with a little plus on top of his head. Feel free to click on that button, and that gives a way of raising your hand or putting a few little icons in just to give some feedback to our presenters as well. So now I'd like to go ahead and present today's speakers for our presentation. First of all, we have Kim McFarland, who is a nurse. Kim is the Trauma Injury Prevention Coordinator for Texas Health Fort Worth, which is a level 2 trauma center here in our local area. Kim has 18 years experience as a nurse and has worked in multiple care areas, including trauma intensive care unit, transplant coordinator, school nursing, high school health science teacher, and injury prevention. So great educator. In her current role, Kim collaborates with community representatives to develop, implement, and evaluate community injury prevention programming. And Kim serves on several community committees that address injury prevention, including serving as the chair for the Injury Prevention Committee at the North Central Texas Trauma Regional Advisory Council. Kim is also a strong person or involved in our committee with the Fort Worth Safe Communities Coalition, bringing this to you this week. Brandon Pate. Brandon is our second presenter, and he is with the Mobile Integrated Health. He's a supervisor at MedStar with mobile healthcare in Fort Worth, Texas. And within this position, he oversees a variety of community health programs and initiatives that aim to promote health literacy, address the determinants of health, improve patient outcomes, and enhance the patient's experience. And in 2018, Brandon received the American Ambulance Association Star of Life Award for his work on developing an in-home fall risk assessment and intervention program. Brandon is a graduate from the University of North Texas Health Science Center with a Master in Public Health degree. So obviously we have two very well educated presenters today to present on this topic. So I want to thank you again for joining us today. And at this time, I'm going to turn it over to our presenters.
Thank you, Kathleen. And also thank y'all for joining us today as we talk about older adult falls. Can we go to the next slide, please? So today, I would be remiss if I did not talk about why we're here and why the presenters today and throughout the week are so passionate about the topic. Falls among older adults is a public health issue. 1 in 4 adults aged 65 or older fall each year. And then community-wide efforts are in effect in North Texas to help reduce the falls and shape policy, offer community-based programming, and change clinical care. The Stop Elderly Accidents, Deaths, and Injury Toolkit, or the STEADY Toolkit as we'll call it, was created by the CDC originally for the clinical setting, but it has been transformed into a toolkit that is applicable across almost all settings. We have used it in the community setting, within our faith-based community setting, within education arenas. So it's something that everyone can draw on and take pieces of and apply it to where what they need. So the toolkit assists in screening individuals for risk of falling, and it helps to assess or identify the risk factors, and then it helps to decide interventions through action, which could be in the clinical setting or the community setting. Next slide. One of the key resources in the STEADY Toolkit is the Stay Independent brochure. This is what a lot of us use to help identify if an individual is at risk for falling. You can answer yes or no to particular questions, and if you answer yes and you score more than 4 points, you've been identified at risk for falling. This handout can help provide guidance for providers in the healthcare setting as well as in the community setting. And if you look at it, they all address, issues about falling. Have you fallen in the past year? Do I use or been advised to use assistive devices to get around safely? Sometimes it also asks and inquires about emotional. Sometimes do I feel unsteady when I'm walking? I steady myself by holding on to furniture when walking around. I'm worried about falling. I need to push up with my hands to stand from a chair. I have trouble stepping up onto a curb. I often have to rush to the toilet. It also addresses medical or clinical issues. I have lost feeling in my feet. I take medicine sometimes because it makes me feel lightheaded or dizzy or even more tired than usual. I take medicine to help me sleep or improve my mood, or I often feel sad or depressed. So there are different levels in there that this toolkit addresses. It addresses mobility, emotional well-being, as well as the clinical side. And then you can also see the why it matters, because we know that addressing, if you have fallen in the past year, you're more than likely to fall again. So this is a good guide for your providers, and it helps, maybe break some of that communication. They can see, maybe if you are using your assistive device, can help make some of those proper referrals if necessary. Next slide. So some of the risk factors on there are poor balance, mobility issues, medication review, annual vision and hearing examinations, and home hazards. These are key things that we are going to be talking about in the rest of the week throughout this series, so I won't go into them much, but these are the highlights. You know, poor balance, you know, it will, in addressing it in the steady, stay independent, it can help us determine whether you need any type of evidence-based programming that can help with mobility or strengthening, such as Tai Chi, a matter of balance, bingo size, all those, some of those things that we will be talking about later this week. Medication review, we know that different types of medication or certain classes of medication can lead to falls. As we grow older, our body metabolizes food differently, and this includes medication, and sometimes slower. And then medications that we maybe have previously taken, we can now develop side effects to. So it's very good that we talk on a regular basis to our healthcare provider about those medications, and then asking those important questions, advocating for ourselves. What is this medication for? What could be some possible side effects that I may get from this medication? One of the things that we really stress as part of this screening and as part of providers is that we ask you to be a partner or a best advocate for yourself. We want you to partner with us as providers. You're a part of that healthcare team. We need to know what's going on with you. And then we like that feedback, you know, hey, I've done this. This really helped my mobility. I tried a matter of balance. It was good because of this. And then bring, that opens up conversations between the provider and the individual. Another thing that is recommended on the Stay Independent in the Steady Toolkit is that you receive annual hearing and vision examinations. We know that older adults' visions can change on a yearly basis, as well as maybe cataracts can develop. So all those can impair your vision, and impairing your vision can lead to falls by not being able to maybe see those curbs as we're stepping off of them, or those gradient changes. So, you know, annual hearing and vision tests. Hearing has been linked in several new studies to fall prevention as well. So we really recommend that if you can, get an annual hearing test. Home hazards. These are things within your home that can cause you to fall. You know, maybe it is a pet. You know, some of those smaller dogs get up around your feet, maybe when the doorbell rings, and that can cause a fall. Hazards, you know, those rugs can come up or curl at the end, can be a tripping hazard. Water, all those things that we've talked about. I think we will talk about later in the week as well about needing some of those assistive devices and where you can find the resources for those, getting those assistive devices implemented within your home. Next slide. So within the CDC toolkit, there are all kinds of information, not only for the individual, but for providers as well. These are just a few of the handouts or deliverables that can be provided if you are at any event, or that are available for our individuals online, where they can take the home safety checklist. It goes through every room in your house and helps you identify hazards or risks for falling. Postural hypertension, it tells you about medications that may be causing you to be dizzy, or what even postural hypertension is. And that is when you get dizzy, maybe from going from a lying position to sitting, or sitting to standing. It gives you tips on how to approach these topics, that topic with your provider, or ways that you can maybe help prevent a fall from that, like always having something near you when you go to stand. And then there is also a tool resource for caregivers out there. So helping sort of accumulates all of this information and puts it into an easy read for those providers. Also, the toolkit has information for our healthcare providers. It has information for pharmacists, primary care providers. They can incorporate this information, this steady information, into their daily practice as an education. It has algorithms, screening tools, fact sheets, even case studies that those providers can review to help identify fall risk and then implement that into their own practice to reduce falls among the older adult population. Next slide. The My Mobility Plan is something that is available on the CDC website. If you go to mymobility.com, it will pull that up, and it asks information questions, and it'll develop this plan for you that will help you determine the 3 key areas. And then they also have a sheet about medication as well. It's going to help you develop a plan for yourself, whether you're at home, in your neighborhood, and then ways to stay independent. This is based on evidence-based practice where they can take to protect their mobility, how to maintain safe driving practices, prevent falls. It includes survey data and focus groups. So the My Mobility Plan is very easy to access and should be, it can be done on their own without going to a provider, and it can be used in conjunction with any of the material or literature, other resources that were mentioned above. Next slide. So what the main take I want you to do from this is speak up. We really want you to be an advocate for yourself, to help, to partner with us as healthcare providers to keep yourself safe, to keep you from falling, getting those annual examinations, eyes, hearing, vision. You can actually even go and have a fall prevention screening on a yearly basis. And all this is to make a safer place for you, a safer home, and to help prevent falls in our population. Next. Thank you. And then I will leave it to Brandon to share the work that him and MedStar are doing in our community.
Well, thank you, Kim, and thank you for that information and for highlighting those things that can be done to reduce the risk for falls. So as they had introduced me, my name is Brandon Pate, and I am the supervisor for the Mobile Integrated Health team at MedStar. And I just wanted to spend a few minutes to briefly explain how we have incorporated the STEADY toolkit into our practice at MedStar. And I also want to talk a little bit about some plans that are in progress to broaden our reach in the community and to broaden our impact when it comes to falls. So next slide, please. So I always like to start anytime I do a presentation like this, I like to just start off with a few facts and a few numbers about MedStar that some people might find interesting. So MedStar is a governmental nonprofit agency. It is the exclusive ambulance service provider for Fort Worth and 14 surrounding cities. We have over 500 employees that work for us here at MedStar. And the service area that we cover is over 400 square miles with over 1 million residents that reside in that area. And we do about 150,000 calls for service each year. But we are more than just a mode of transportation to the hospital when someone is sick or injured. So in addition to all of those 911 calls that we're doing each year, we do have an entire team that is dedicated, and their sole responsibility is to prevent 911 calls. And that's the team that I supervise. It's the Mobile Integrated Health team. Next slide, please. So within this department, this Mobile Integrated Health team, we have several programs and initiatives that are focused on prevention. They're focused on improving the health of the community by promoting wellness and by providing education and by ensuring that our patients have access to their primary care physician or any other doctor that they may need. And we also want to ensure that they have access to prevention services and to other programs that are available in the community. Next slide. So for these community health programs that we do at MedStar, we're meeting with individuals in their homes several times per week, where we work with them to identify some health-related goals that they may have, to help them identify barriers that may exist and barriers to achieving those goals. And then we want to help them find the right resource that will help bridge the gap between where they are and where they want to be in the terms of their health and their well-being. So just a few brief examples of this is maybe a person has a primary care doctor, but they don't have transportation. So we're going to work with the patient and with our community partners and other agencies in the community to find them a workable and a long-term transportation solution, just so that they can go in and see their doctor, so they can go see their doctor and talk about their concerns for falls, for example. So another example, and a fairly common example, is sometimes the patients we're seeing in the homes, they don't have money to afford food on a day-to-day basis. So through our partnership with the Tarrant Area Food Bank, we carry emergency bins of food that we'll give to them right at that time. We will then, link them to their local or to the Meals on Wheels, or maybe another resource in the community that works for them. But out of all the things we do, what we're seeing is one of the most impactful things that we are doing is completing that fall risk assessment that Kim had talked about. So we adapted that program, the STEADY program, so that it could be delivered in the home. And so, as Kim had said, falls are not an inevitable part of getting older. And we know that if we properly screen our patients, assess for those risks for falling, and intervene, we can make a huge difference within our community when it comes to injury prevention. So how do we do this? Well, we use the same material that Kim had went over, and we'll walk our patients through it. We start with that Stay Independent brochure and that questionnaire, and then based upon those answers, we work with that patient to develop a plan that works for them to reduce those identified risks for falling. Again, that may be referring them for physical therapy, or maybe it's getting them signed up for a matter of balance class in the community. Or maybe it means we're contacting their doctor to discuss some of the side effects of the medication, putting that patient at a higher risk for falling. So once we get all that squared away, we will then walk them through that checklist that we talked about earlier, the check for safety checklist. And we'll go with them room by room to help them identify the risks in their house or the hazards in their house that could predispose them to a fall. So from the unlit hallways between the bedrooms and the bathrooms to unsecured throw rugs, or simply clutter on the stairs or clutter in other narrow spaces. These things can all increase our risks for falling. And in some instances, maybe they just need some grab bars or handrails in the bathroom. And again, we're going to work with our resources in the community and our community partners to make sure that that home is safe. And then make sure that we are doing everything we can do to minimize those risks. Next slide, please. So as I had said before, at MedStar, we know how serious a ground level fall can be. And we know how serious the consequences of falling can be. So we're always looking for ways that we can better serve the community and do our part in reducing this risk. I had mentioned before that we are currently doing over 150,000 calls every year. And typically those requests will follow this path that's on the screen now. It's someone becomes sick or injured, and then they react and they call 911. And then based upon that 911 call, MedStar is going to react and send an ambulance. And then when the paramedic arrives there at the house, they're going to react and provide the appropriate treatment depending on that patient's signs or symptoms. And typically those encounters are going to result in a ride to the hospital in the ambulance. So that's a lot of reactivity, a lot of reaction, a lot of reactive processes. So we always ask, what can we do to be more proactive and less reactive, especially when it comes to falls and when it comes to minimizing the fall risk within our community. So at MedStar, we're working on a project now that will hopefully position us to be more proactive on that front. Since we are in homes within the community over 100,000 times every year, it does provide us a great opportunity to maybe complete a brief fall risk screening when someone calls 911, and to be the ears and the eyes that are in that home even if they've called for a headache or chest pain or shortness of breath, after we've stabilized them, we get them to feeling better. I mean, what would it look like to ask them the 3 key questions? Have you fallen in a year? Are you afraid you might fall? Or do you feel unsteady when you walk? And if they were to answer yes to any of those questions, I'd love to see a time where we're able to schedule a follow-up visit with them, you know, once they're home from once they're home from the hospital, and schedule a follow-up visit and go into the home and go over that steady toolkit with them just to make sure we're doing everything we can do to minimize their risk for falling. So that's what we're doing about falls in our community from the MedStar front. And I'm thankful for the opportunity to share the work we're doing. And I'm going to turn it back over to Kathleen.
Thank you both, Kim and Brandon, for that presentation. I just want to say that I think it's wonderful to hear that our emergency response system, our EMS, you know, that it's not just reactive, that it's also proactive. You guys are on the preventative side of trying to reduce falls and not just to respond to falls. So I'm going to give our audience a little bit of time to, again, if you have a question for either Kim or Brandon, please do one of 2 things. You can type your question into the chat, or if you would like to verbalize your question directly, use your little reaction button, which is just to the right of your icons down at the bottom, just to, you know, a thumbs up or a hand, either one, and that'll tell me that you would like to ask a question, and then I'll introduce you to ask your question. But I'm going to start the ball rolling a little bit. Brandon, I'm a little more intrigued a little bit about what you were saying from the preventative side. So if someone is experiencing falls, you said if you're called out to the house, that will prompt this assessment and screening and evaluation. Can participants also be proactive and somehow call MedStar and say, can I be part of that mobile integrated health team, you know, fall prevention?
Sure. So as it stands now, we're working with various hospitals and insurance companies to get as many people in and through these programs as we can so that we can have the biggest impact. But we do take self-referrals, and that can be done by calling our main number and asking to speak with someone on the mobile integrated health team. We're more than happy to you know, I guess reward their proactivity by taking care of their risk for falls.
Well, thanks. I mean, that's great. And I think, again, for them to hear not only MedStar, but MedStar Mobile Integrated Health Care, I mean, it's just wonderful. It almost sounds, again, like promoting, you know, good health behaviors. So we do have a couple of questions. The first one is from Brenda Wilson, and it says, Brandon, do you ever provide any support of teaching patients to access telehealth? And that's definitely become a hot topic in this world right now. So do you see MedStar Mobile Integrated Healthcare using telehealth maybe in delivering this program?
Sure. So especially over the last several months, we've seen a huge increase in the utilization of telehealth, even with our own patients. So that's us doing, you know, video calls with the patients. We're still going to do the in-home visits if that's what they want, but we have done just visits telephonically, and or even linking them to their primary care doctor with a telehealth visit. As we move forward with some new initiatives coming down from Medicare and Medicaid, I think telehealth and EMS is going to be a bigger partnership where there's going to be some changes and restructuring in the way ambulance services get paid, and a lot of that's going to be based on telehealth and based on linking them to a physician via the phone or via video call.
Fantastic. Now, Brenda has a follow-up question before I get to our other question from another participant. Brenda, I'm going to go ahead and invite you to unmute if you would like. She has a follow-up question to that.
So my typing, it auto-corrected the wrong word.
That's all right.
So what does that linking look like? So do you actually would you actually be in the home and help the person get onto a telehealth visit with their provider?
Sure. So what we've seen, because there is a technology component that some individuals do struggle with, especially, I mean, it seems like Zoom meetings and telehealth didn't exist until this year, right? And so a lot of people do have trouble just navigating the platforms, the different platforms. There's several that can be a little confusing at times. And so we will certainly do that in the home. Or maybe they need an in-office visit and they don't have transportation to get there. We have a partnership with Lyft Concierge where we'll actually provide the transportation to and from and we'll pay for it. Something else that we've noticed, especially when you're talking about all of these little intricacies of someone's health and all of the little things that fit together that are putting that person at an extreme risk for falling, is they will go to their doctor and they'll forget to mention 90% of it because there's just so much going on. So there are times, and it's happened several times, where our team, our community health paramedics, will take that patient to their appointment. We'll sit in the appointment with them and we'll communicate all of the concerns. We'll communicate all of the risk factors so that we're ensured that they all get addressed.
Wow, that's definitely going even beyond. And I guess there's a great question here, and I'm not sure, it's from D. Spangler, and feel free to unmute yourself if you would like. I don't know if it's Mr. or Mrs. I'm going to guess Spangler. But the question is, does Medicare pay for any of these services? So
currently, we work with a managed Medicare company that it's United Healthcare and then Southwest Health Resources, and they pay us to go out and do this. Traditional Medicare, not yet, but we do see that on the horizon, as I alluded to earlier, with some reimbursement changes that were coming. But otherwise, we do take referrals from the hospitals, and the hospitals are actually paying us to go out and do these programs so that the people stay healthy and the people stay well.
Wow. So you're saying that definitely the work is there to try and get insurance companies, especially maybe some of the managed healthcare companies, to be on board with this, to see the value into it so that you can get reimbursed and funded. But yet that the hospitals have seen the value so much that they're saying, we will support you in these initiatives to go out.
Sure, absolutely.
That's great. And I think even the outcomes that you are able to collect during your delivery might even help provide the validation to even get more insurance companies on board with supporting and reimbursing.
Sure, that is very true. We do track everyone that gets enrolled in one of our programs. We're tracking their 911 use from a year before they're enrolled to a year after, just so we can do some before and after changes. We track admissions. We track how they perceive their health before they were in the program and how they perceive their health once they're out of the program, once they've graduated. And then we've seen some very promising outcomes.
That's fantastic. So you say graduating. What does it take to actually graduate from the program? Is it a set number of visits, or is it a presentation of improved control?
Sure. So it's a very goal-directed program. During the first couple of visits, we're going to go out. We're going to do a comprehensive assessment on the social things, economic things, environmental. Do you have social support? Do you have a primary care doctor? Do you have your medicines? Do you have a way to get your medicines? Do you understand how to take your medicines? And then we'll do that fall risk assessment as part of that. And then based upon that, we work in partnership with the patient to develop those goals. And then for how typically it's 30 days to 90 days is the typical program length. But once all those goals have been achieved, will actually graduate you from the program with a certificate and everything. It's pretty awesome.
That's neat. And I love that it sounds like those goals are being set together with the individual,
absolutely.
What it takes. I'm going to turn the questions a little bit to Kim, but again, to our audience, if you have any questions for either one of our speakers today, please take advantage of the opportunity and to type it in, or I'll again continue to scroll down and look for any hands raised. But Kim, so Brandon mentioned that partnership with hospitals to try and work towards preventative steps. Obviously, we're used to going to a hospital when we have an injury occur or an illness occur. So what is being done through your initiatives, as you indicated, with injury prevention from more the preventative standpoint?
So my job is actually unique. I do not provide direct patient care. I go out into the community and try to teach individuals how not to become a trauma patient, because no one ever wants to come see us here, right? So there are several initiatives that we do. We partner with some of the agencies, local agencies, and our guest speakers for like a Matter of Balance, Aging Mastery program, which all have a foundation. A Matter of Balance has a foundation in focusing on fall prevention and the fear of falling, is that emotional attachment that you can have for falls, and how to prevent that and reframe your mindset on falls. Aging Mastery is a great introduction program that can be done. It touches on various aspects with exercise, home safety, nutrition, all those different aspects that impact not only your life on a daily basis, but can help or can be linked to falls. I also provide programming where we used to go out into local communities and do a small, intimate program based off of the CDC's Steady Toolkit, and use our local community partners there in that area. So if we were in North Fort Worth, we would focus on using providers that were in that area to help provide those screenings. We would usually partner with someone to do vision screenings to help determine if they needed some vision adjustments. We usually had our local EMS, and MedStar has helped several times, come out and do blood pressure checks to see if maybe their blood pressure was high, and then ask them the questions about those postural hypertension. You know, do you feel dizzy when you go from sitting to standing? And then we also had physical therapists and occupational therapists within that area that came and did functional testing. Different testings like the timed up and go, where there are set parameters that can help determine whether that individual is at risk for falling. And then after they would go to each of these individual stations, they would be asked to provide, or they would be provided a sheet of paper that that individual practitioner could write down notes or, you know, like maybe they needed to do a Matter of Balance, or maybe they need to see their doctor about medications, and they would take that individual sheet of paper to their provider, where they would partner with their provider to become to help get that adequate care for that is needed based on those results within that assessment. It's really meant to be more of an intimate. There was a lot of talk between providers and the individuals that they're, and those providers were actually able, you know, to make suggestions that can help prevent falls to those individuals. It wasn't a hurried conversation. A lot of times those providers were able to spend 3 to 5 minutes with each individual going over what they thought was the best practices for that individual based on their screening results.
So it sounds like a lot of just really stepping out into the community and trying to increase awareness and education,
Right.
and bringing, I love that idea of bringing the local providers, you know, to an area. And as far as, and obviously I know in this time, we're always saying in this time of
Right.
COVID, it's a
I
little
know.
hard to sort of have those community gatherings or fairs or things of that sort. But hopefully again, when they're restarted, how would somebody gain awareness of an understanding of maybe when one of these events is going to take place that you would be supporting?
Usually we try to publicize that either on our Texas Health website, or we do actually partner with a lot of with organizations at 60 and better, maybe go into one of those community centers where they already have a group of people that are there, or maybe they are fixing to have a matter of balance class. So this is a good prereq to a matter of balance. It gets that patient or that individual on that mindset thinking, ooh, maybe I do need that class because I have identified through this program some needs. And a matter of balance is a lot, can fulfill some of those needs, especially when with regards to our emotional fear of falling, and then some of those strength and balancing exercises that are done within that program. Like you said, during this time, there are some virtual classes that are just now starting to come on platform. It does take a while for some of these programmings to transition just from various regions. So I know some of those are able to be obtained. So you can look on your 60 and better, as well as I think it's United Way maybe, their sites, and they can help guide some of those classes. Just for licensing, some of these are not able as of right now to be converted to the virtual platform, but I think that is the way in which we are moving. So I think we will see more and more of these being offered on this virtual platform. But you know, with that maybe comes some training that's needed on how to access, like Brandon said, some of this virtual platforms. So maybe that's something that we need to look for in the future as providers, as to how do we let this population know how to access these programs virtually. Is it something we can do over the phone, call them, walk them through it if they have access to computer, or, you know, that's something that we're just going to have to figure out as providers, as to how to make sure we can get these programmings to the people who need it the most.
I agree. I think that there's, you know, there's always joy and, you know, a little bit of appreciation when you can gather as a group and make connections and make social connections. But I think for some people to get involved in these programs, there's also that barrier of transportation, you know, things of that sort. And so hopefully this is a good representation that we even have people logging on today for a talk, that, you know, we're all getting a little bit more comfortable with the technology to do it, and maybe the opportunity it provides, and even allows a little further reach for those individuals that live a little further out. As long as, again, obviously we all need to have internet connection and things of that manner. So before I don't see any other more questions in the chat, but I do want to give an opportunity. I think we have at least one participant on a phone line. So if anyone is on the phone and you would like to ask a question, feel free to just press *6 on your phone, and that will unmute you, and feel free to ask a question. And I believe, if I'm looking at this correctly, I think we only have, I'm going to identify as Bruce's iPhone. So if we don't see Bruce's phone go unmute here, I'm going to say that I think you've answered all of his questions. But we're pretty much almost close to the end of our time together, and I definitely want to thank our presenters, Kim and McFarland and Brandon Pate, for their time and expertise in sharing. Again, our hosts here at the Health Science Center for providing this webinar platform, and also for our participants for joining today. So thank you for joining in. We hope that you join us for the rest of the week. We do have, again, as you can see on your screen maybe, tomorrow we're going to have another topic which will dive a little bit further into, okay, medications, which ones may increase your risk for falls, and identifying some of those medications. Of course, we don't want you to stop taking any medications, but we want that, again, to prompt the conversation. As you heard Brandon and Kim say, this is really a discussion, and a lot of times the most important people that need to be in that discussion are both yourself as well as your physician. We have two great presenters tomorrow. One that is a pharmacist that will be discussing, again, the medications. Another one, a very experienced nurse that we'll be talking about that condition and issue that Kim alluded today with postural hypotension. And that's unfortunately one of the reasons that can cause some of that dizziness, as Kim indicated, when you change positions. So she'll give a little background and insight on how you can assess that. So we hope again that you'll be able to join us tomorrow and throughout the week on some different topics each day. And Kim also introduced a few different names of some programs, and we're going to have some presenters at the end of the week that give a little bit more insight into those programs and maybe even a discussion and possibly even a demonstration. So we hope that you'll continue to join us this week. And on that note, I will thank you again and wish you a great afternoon.